I'm Dr. Elin Najafi, and I am dermatologist, cosmetologist. And today we will have some topic together, and I hope it's gonna be very good meeting. But the rest of nasolabial, because exactly of this artery, you are not allowed for going to deep injection. Take note about that. I will repeat it again, but then by cap, you will just put it inside and try to give some angle, 45 angle for the needle.
So, hello everybody. I'm Dr. Ahmad Ashraf, dermatologist. You can see that the redness and the hypertrophic are greatly improved, and after two sessions of DQRF, dynamic quadrupolar radiofrequency, and fractional needle radiofrequency, you can see that the scar is greatly improved.
So just to know each other, I'm Dr. Fuad. I'm an aesthetic plastic surgeon, professor of University of Unicum, Milan. And then we go for the lip line. Here there is no bone, so you have to take the skin between two fingers and inject with a whole needle, the 13 ml sized needle, 30 gauge. You have to go straight and inject the 0.1 ml.